Hello everyone, I'm Sian and I'm talking to you today about patient and public involvement in research, or PPI. This refers to the active involvement of patients and the public in shaping research, ensuring it reflects real-world experience and that it meets real-world needs. I'm a member of the DecodeME Genetics Study Patient and Public Involvement Steering Group, and I coordinate PPI for a new project called PRIME, a research infrastructure building project for ME. I also live with ME myself. That dual perspective, both as someone with ME and as someone working professionally in the charity and research sectors, has shaped how I approach involvement. And it's shown me just how powerful it can be when done well. So I want to share how DecodeME built a gold standard model for patient and public involvement, PPI, and how we're building on that through PRIME. For those who don't know, DecodeME is the world's largest study of ME/CFS. We've collected over 18,000 DNA samples and already identified 8 genetic signals that influence the likelihood of developing the illness. This is a huge step forward for ME research and gives us so many clues on what to investigate next. It has also been incredibly validating for people with ME, many of whom have battled stigma and denial of their experiences since getting ill. But DecodeME isn't just a scientific and social achievement. It's a model for how we embed lived experience into research in a way that improves impact and scientific quality. DecodeME has been a huge collaboration. We have researchers, teams that deliver specific aspects of the study, communications experts, and people with ME all working side by side. Our PPI steering group is embedded in the project's governance. Everything from press releases to the ethics application to the risk register was reviewed by the steering group, meaning our experiential knowledge formed a key lens through which every deliverable was passed. Members from this group sat on each of the other teams and were conduits for information and decision making. We weren't just consulted, we were part of the decision making. And when capacity fluctuated, as it often does with ME, we adapted. We brought in additional contributors or had PPI steering group members join additional teams to ensure that continuity. That flexibility there was key. It meant that we could maintain momentum without compromising accessibility or inclusion. And I know for me, being able to pass the baton on to trusted PPI colleagues during periods of worse health was incredibly reassuring. So what does accessible involvement actually look like? Most of our meetings happened online. Meeting times, durations, and formats were all shaped around the needs of each group's PPI members. Some team members met for just 30 minutes at a time, others for an hour or more. Where people struggled with light sensitivity, staff made presentations with dark backgrounds, and they were always open to different methods of communication, be that emails, Teams, phone calls, whatever worked for the individual. We shared agendas and documents well in advance to help PPI members pace their energy and involvement, and we co-created timelines. I'm not alone in having attended meetings from my bed on crushy days, and I was never made to feel my involvement was lesser because of that. Plus, we tried to ensure involvement didn't need to be all or nothing. This wasn't always easy for the individual. Some of us pushed past our limits because we were so invested in the project, but the principle that people could step back and rejoin as their health allowed was always upheld. One of our biggest contributions was developing the participant information documents and the DecodeME questionnaire. We tested all these documents with small groups of people with ME, made changes based on their feedback, and saw a 20% increase in correctly completed postal questionnaires because of this. That's a direct impact on data quality, driven by PPI. We also helped shape how DecodeME supported its participants. PPI contributors wrote sensitive, thoughtful responses to common queries from participants, and when more complex questions came up, we worked with staff to craft responses that reflected the experience of ME. This made the study more responsive, more human, and built impressive levels of trust with the community, enabling us to build a big enough cohort of participants to power our analyses and find the genetic signals that we have. And our involvement didn't just stop at design. We were active in delivery too. PPI members helped create a video guide for returning DNA spit kits and edited our outward communications for accessibility. We also co-hosted webinars with researchers that reached tens of thousands of people. This wasn't just about inclusion for the sake of it. It was about impact, and it worked. This is what true involvement looks like. Not tokenism, not consultation after the fact. Our principal investigator, Chris, devolved decision-making. Together, we embedded PPI in governments. We budgeted for contributor fees, and we created space for people with ME to shape the research from the inside. Personally, I've gained so much from co-producing DecodeME. It's helped me grow, supported my career, and given me friendships and connections that I truly cherish. And it was meaningful for staff too. One team member told us, "This is the most fulfilling role I've ever had." DecodeME is still analysing data, and PPI members will be co-authors on future publications, including one on PPI itself. But we're also building on this model through PRIME, a new UK Medical Research Council funded project to strengthen ME research infrastructure. PRIME has three main aims. The first is creating at least 15 new research collaborations to coordinate and engage researchers over the next 4 years. The second aim is to build 2 international consortia, one focused on genetics and the other on molecular biomarkers. And thirdly, I am hugely excited to now be working for PRIME to create the world's first large-scale pool of PPI contributors for ME research. At least 100 people with experience of ME, either as patients or carers, trained and ready to co-produce research. And it means that future ME research can be shaped from inception by people who truly understand what it's like to live with this illness. This is all about making meaningful involvement easier, faster, and more effective for researchers, while ensuring that research stays grounded in real-world experience. As many of you already know, the ME community is full of brilliant minds. Faced with a lack of care and treatments, many of us have extensively read the research literature around ME, trying mostly in vain to find something that could help us. Some of us are trained scientists, others just geeky lay people. But whatever our background, our experience of ME gives us a vital role to play in research. And when we involve people meaningfully, we don't just improve the research, we accelerate the search for treatments and one day a cure. In time, PRIME will be actively recruiting researchers and industry partners to join our network, and members of the public to join our PPI pool. So keep your eyes peeled, there will be new opportunities to collaborate just around the corner. Thank you.